What do pharmacy students learn in pharmacy school? So many things, and I will try to rattle them off in about a minute or so. We start out with medicinal chemistry, so that's like learning about receptors and binding and like how the actual molecules interact with each other. We learn about pharmacokinetics, which is what the body does to the drug. And then we also learn about pharmacodynamics, which is what the drug does to the body. They're not the same thing. We have practical skills and communications labs where they bring in actors as standardized patients, and we learn how to do proper assessments, how to ask the right questions, and just how to talk with patients in general. Not just patients, but how to talk to other healthcare professionals, nurses, doctors, how to write prescriptions, how to read prescriptions. And the bread and butter, our main jam, therapeutics on all the disease states. Pulmonary, your lungs; dermatology, your skin; cardio, your heart; rheumatology, like rheumatoid arthritis and lupus; oncology, cancer; endocrinology, like diabetes or hypothyroidism; psychiatry, mental health; pain; infectious disease, my favorite; immunology; bone health, like osteoporosis; men and women's health; pediatrics, geriatrics; anything to do with disease and drugs, we cover it all. Maybe to differentiate it from med school, and all the doctors out there watching, let me know in the comments. We get a brief overview of disease states, but then we get all the pharmacological options. So less so on diagnosing, but a lot on pharmacotherapy. We also take courses on pharmaceutics, like compounding, like literally how do you make the drug in the lab. Toxicology, what happens if you take too much of the drug. We study pharmacy business, pharmacy law and ethics, and pharmacy leadership. And at the end of your schooling, you may get to take some electives like pharmacogenomics. How does a person's DNA match with what's the right drug therapy to use, research, indigenous health, opioid use and addictions, things like that. And usually between each school year during the summer, you'll do some practical skills work, either working in a community pharmacy or a hospital, or by the time it's your final year, both, and probably some other special stuff. That's pharmacy school in a nutshell. What questions do you have?